Welcome back. November is Epilepsy Awareness Month. 1 in 26 people will have epilepsy at some point in their lives. Helen DeVos Children's Hospital is the only National Association of Epilepsy Center Level 4 program in West Michigan. That's the highest designation in epilepsy care, capable of seeing and treating the most complex forms of epilepsy. Here to tell us more about the program and the care he provides is pediatric neurologist Dr. Seth DeVries. Dr. DeVries, thank you so much for being with us.
Oh, absolutely. My pleasure.
So let's start with the basics. Just tell us, what is epilepsy?
Yeah, well, I think in order to start with what is epilepsy, we need to talk about what is a seizure. Because a seizure is a form of abnormal electrical activity that's happening in the brain that's causing some sort of change in a person's behavior. And that could be abnormal shaking, pause in appearance, abnormal sensations or visions or hearing, all sorts of different things that can occur. And that is essentially what a seizure is. And so once we know what a seizure is, we can talk about epilepsy, because epilepsy is defined as 2 or more unprovoked seizures.
Okay.
And that's it.
That's it.
Or a single unprovoked seizure with an abnormal EEG or an abnormal MRI imaging or electrical evaluations that could indicate a risk for seizures.
Okay, and you're saying, you know, we're talking 1 in 26 people. You can get epilepsy, it will go away. I mean, you're obviously dealing with the littlest patients. It's kind of interesting how this works.
Yeah, I think in my line of work in pediatric epilepsy, there are a lot of children who have the potential to outgrow their epilepsy. And I think that's an important thing to remember. And so talking about that 1 in 26 number, it absolutely is that point of 1 in 26 people will either have had epilepsy, do have epilepsy, or will have epilepsy.
Right. And you say people are very functioning with this, and treatments are a huge help. So tell us what you do.
Absolutely. So, I mean, first of all, with functioning, most people with epilepsy, you wouldn't even know it unless they told you. And the treatments that are available are a major part of why that is the case, because, you know, we start with medicine. Medicine is usually our first line approach for treating epilepsy. And there are all sorts of medicines available for our patients at this point, and new medicines are being produced and discovered every day. It's incredible.
Yeah.
Unfortunately, about 25% of our patient population with epilepsy will struggle with something that's called medication-resistant epilepsy. Okay. And for those patients, no matter how much medicine we are providing, it might not work. And so then we have to look at some other options instead. And so in that regard, there's essentially 3 other potential opportunities that we have for our patients.
Okay.
The first one would be a medical diet for our patients. Okay. There are specialized doctor-run diets that we can provide. Okay. The second option that we might have for our patients would be something that we call neurostimulation, and that's essentially providing an electrical stimulation that travels into the brain to disrupt potential seizures for our patients. And then the third option that we have is surgery. Okay. We can work with our colleagues in neurosurgery and actually resect and remove the part of the brain that is causing the seizures when it is safe to do that, mind you. It's not always something that we can do, but when we can, it's a great option for our patients.
Wow. Okay. And so for someone like just you and I, if you see somebody having a seizure, what can we do to help someone?
Yeah, great question. The first thing, stay calm. I think that's something easier said than done. You might be watching somebody having a seizure, like, oh my goodness. All right, check my own pulse. I'm doing okay.
Right.
You can check on them.
Yeah.
Most important thing you want to do, just clear the area, help that person to the ground, put them on their side. Okay. Then you want to turn the chin towards the ground, slightly up. That's going to open up their airway. It's going to help them that if they do drool, if they vomit, if they happen to bite their tongue and bleed, everything's going to go out of their mouth. They're going to, that way they won't choke or aspirate on anything. Okay. Do not put anything in their mouths. Okay. I know that that's something that a lot of people want to try and do. There's this temptation to put something so that they don't bite down. If you put your fingers in their mouth, you're going to lose your fingers. So don't do that. But the hardest part there is wait. Yeah. Most seizures will last less than 5 minutes. Most seizures will stop on their own. And if we have an opportunity to take care of that person, that seizure is going to go away on its own. Okay. There are some seizures that will go on for longer than 5 minutes. Okay. And for our patients who experience that, we do have rescue medicine that we can provide. The most common rescue medicines are a nasal spray that will go up the nose. And for people who do struggle with epilepsy, many of them will have that medicine available so that a caregiver or a bypasser might be able to provide that medicine if they know what they're looking at.
Sure. Okay. Well, Dr. DeVries, thank you so much for being with us. Such valuable information. We really appreciate it. Again, it is, you want more information, you go to spectrumhealth.org or call the number on your screen. We'll be right back.